I'm going to back up a second because I didn't hit record. So let me just back up really quick. T3 and T4 are the primary hormones produced by the thyroid. When we have hyperthyroidism, it means there's an elevation or an oversecretion, typically of T3 and T4 of those thyroid hormones. Now, the thyroid hormones, to go back, regulate metabolism. So if you think about it, if we have an increase in T3 and T4, then we're typically going to see an animal that's in a hyper metabolic state or an elevated metabolic state. And that's how they, manages their proteins, their carbs, and their lipids, their body temperature. That's what the thyroid gland. So when we're talking about hyperthyroidism, which is more common in cats, sorry, I'm repeating stuff for my recording, but it's more common in cats. They're in this essential hypermetabolic state, rare in dogs. Now, whenever we see an enlargement or a mass, now that means there's an overgrowth of tissue in that area. But if it's benign, sometimes it's called hyperplasia, or it does have a name where that means that tissue has kind of overgrown, but it is not cancerous. So they're saying about 70% of cases can be what's called a thyroid adenoma. And that means the gland has become enlarged and it's causing an excess production of these hormones, but it is a benign enlargement. And that can be seen occasionally. And again, if dogs get it, it has a higher likelihood that it is a carcinoma. And again, you're going to look in the neck area. Now, for some reason, these pictures uploaded a little bit grainy. I apologize, but hopefully you can look at this cat and appreciate the clinical signs are pretty glaring. They're pretty like big arrow, this is hyperthyroidism. But the big thing that they were going to start to see is, number one, is weight loss. And not only do they lose weight, but they also begin to lose muscle. Now, if in my old getting to know you PowerPoint, my female cat, she was like 18 to 20 pounds. She was a big kitty. And she started to lose weight. And at first, she really was just losing fat. And my husband was like, oh, this is great. She's losing weight. She needed to lose weight. And I said, I haven't done anything with her. I haven't cut her food. I haven't put her on a kitty treadmill program. I've done nothing to make her lose weight. So there's something in her body that's making her lose weight. Now, the difference in these cats is they lose weight, but they act like they're starving. And again, I try to not repeat stories, but I talked about, she'd jump on the table, she'd take a sandwich, she'd take a whole chicken leg, and this cat was hungry, hungry, hungry. So the problem is that the hypermetabolism is making them burn because they're burning calories at a faster rate. And that's why they feel hungry. Like they can't keep up with their metabolism. And you probably have known people, if you know someone that's hyperthyroid, they could probably literally eat like 3 cheeseburgers and they're not going to even look any different. They're burning calories at such a fast rate. Sometimes people get jealous because they can't eat like that. But the difference is when she was older and she got this, when she wasn't eating, there's certain diseases. If she wasn't eating and she wasn't hungry, that's one thing. Or I'm sorry, if she was losing weight and she wasn't hungry, there's certain diseases. I might think of renal failure or cancer. If she's losing weight, but she's starving, that started to point me in a direction of hyperthyroidism. And that's what your polyphagia is. They want to eat, but even though they might be eating more, they're not necessarily gaining weight. They're burning it too fast. It can progress to vomiting, and she did a fair amount of vomiting, and sometimes they have a heart murmur. And what happens is the hypermetabolism can affect the heart, and you might sometimes pick up a murmur, which is that swooshing heart sound instead of lub dub, you almost hear shh, shh. So sometimes they have a heart murmur. One thing is they're hyperexcitable because they're at this hypermetabolic state. And yes, this cat I had, she was aggressive. or she can be aggressive, but man, she was like, she just wasn't nice and calm and purring. She just always seemed on edge. And sometimes they can actually be aggressive. So it can be like hyper excitable slash aggressive. And then look unkept. One thing, a lot of cats that are sick, they begin to not groom themselves. And so they do start to get that kind of maybe oily coat, or they look matted, and they just look like, they're not kind of taking care of themselves. It can affect their sight. And you might notice, or an owner might say, wow, they acted like they couldn't see their treat, or they acted like, did they bump into something? It's because it can affect blood pressure, and it can affect the eyes. And sometimes you will see an elevated temperature. Hang on, I just have to put my dog on the chain. I apologize because he keeps ringing the bell and I don't want an accident. So all of the clinical signs that come with hyperthyroidism are related to the excess T3 and T4 production. So because it's increased hypermetabolism, but I think the key here is you're usually going to see weight loss in the face of hunger. And a lot of owners may just try to feed their animal more, but they really start to look skinny. And you can start to feel, eventually she lost fat at first, and then you could start to, towards the end of her disease, you could feel like all of the bones, and you can feel like the bones in her face. And when they start to lose muscle mass, after they've broken down fat, they're going to start to break down muscle, and they're just not able to build it. They're just not able to build it back up. So how do we diagnose this? I mean, first of all, there's a high suspicion based on the history. Like if you talk to me as an owner and I describe the losing weight, eating like crazy, trying to steal food, you're kind of starting to go ding, ding, not 100%, but you're like, that's probably. And then the PE stands, sorry, I'm going to start to use some abbreviations. PE is physical exam. And one thing that you can sometimes do, and you can try this on your cats, is if you reach in their neck and you try to grab their trachea or right up at the larynx, and it's called the thyroid slip. If you run your fingers up and down, like back and forth, on her, I could feel an enlargement. Normally, you don't palpate the thyroid. The thyroid's kind of flat up against the larynx, and you slip your fingers and you don't really feel it. But in her, there was a palpable, meaning I could feel it, there was a palpable bump there. So she did have an enlarged thyroid. So first of all, the doctor's going to do an overall physical, and then, listen for the heart sounds. But when you feel the lack of muscle mass, and when you feel the thyroid potentially enlarged, those are kind of red flags. Also, the other thing I should mention, these patients typically, because they're in a hypermetabolic state, they have an elevated heart rate a lot of times. Now, normal cat heart rate on a physical exam is usually about 180 to 220. So when we're getting up to 220 and even a little bit higher, that's what I would consider a tachycardic cat. I mean, a cat can be 200, and sometimes they're scared. They're in the clinic. It's very common to get sometimes these elevated heart rates. If I jump ahead, when I talk about anesthetizing hyperthyroid cats, there's certain anesthetics that we use, like ketamine, that increase the heart rate. I don't use ketamine if I have a hyperthyroid cat because, again, they usually have a higher heart rate. I don't want to give a drug that also increases heart rate. So there's some keys to treating them. And again, sometimes your physical exam might be challenging because they are hyperexcitable and / they can be aggressive. They can be just kind of on edge. Once we suspect it, number one, you're probably going to order a thyroid panel. Now, I will tell you, as a tech, sometimes it's frustrating. My boss will say, hey, let's run a thyroid test on that cat. Well, if you look, when you're in practice, you have a lab form, and under thyroid, it lists several different tests. Sometimes you're going to do what's called a thyroid panel. And a thyroid panel is going to test for something called total T3 and free T3. Now, if you remember from anatomy, I talked about steroid hormones being cholesterol, and sometimes it has to be bound to be brought into the cells. So a certain amount of the hormone is free, which is called unbound, free T3, and some is a bound hormone, which is called your T3 or total T3. Well, total T3 is going to measure what's bound and free, and it's going to then, or you can measure what's free. So that's what free T3 means and total T3. In the body, some hormone is going to be bound and some is going to be free. So you can also do the probably most common test that's run to evaluate thyroid is a total T4. But typically when you're diagnosing thyroid disease for the first time, you're going to test for all of the values, and you'll do what's called a thyroid panel, which will include all of the testing, which is total T3, free T3, total T4, free T4. But remember, you also sometimes want to test for TSH. Now, TSH is not produced by the thyroid gland, but if there is an elevation in TSH, it could be overstimulating the thyroid gland and causing that release. So there's two aspects. Is it coming from too much TSH and we're getting an overproduction of thyroid hormones, or is it coming from the thyroid gland and it's just T3 and T4? So when you do a blood panel, a thyroid panel, you can test for just one of these, or you can test for a couple, So I'm just letting you know. Usually I have to go to my doctor and I say, which thyroid test do you want me to run? And the doctor will say which test we're going to run. The other thing is when a cat comes in, typically you're going to want to do what's called a general chemistry panel. Are you guys in lab? Which lab are you in right now? Lab 2, Clin Lab 2? Okay, you're in 3 or 2. Okay. So Clin Lab 2 is you're doing all your white blood cells. When you guys get into Clin Lab 3, that's when you talk about urinalysis and blood chemistry. A blood chemistry panel, and a lot of times in an older cat, we do what's called a geriatric profile, and you test for liver function tests, kidney, glucose, cholesterol. Because animals with thyroid disease can have other blood chemistries that are altered. So sometimes ALT is alanine transferase. The abbreviation we call this is a liver test. And that's how it's like a cheat way to tell the students is ALT is a liver enzyme. And sometimes because they're in this hypermetabolic state, sometimes you'll get an elevation in your ALT. Sometimes your BUN and creatinine, which are actually kidney function tests, sometimes they can be elevated in thyroid disease. And sometimes they can actually have an elevated PCV, which is your packed cell volume. So I will tell you, usually when an animal comes in ill, you will start with what's called just a chem CBC. And that does an overall blood picture of all the red blood cells, white blood cells, and all the chemicals of the blood. A thyroid test is usually, like I said, thyroid testing is separate. Thyroid levels are not part of a chem panel. So that has to be what we call as an add-on test. And like I said, when you guys get into practice, Antech, which is like a common lab a lot of clinics use, there's a form and you can check off which tests you want. And, sometimes you can do a feline profile. It'll include CBC, chem, thyroid, urinalysis. So, there's a variety of different tests. Obviously, your veterinarian is going to tell you. But this is kind of what you'll do. Now, as far as like radiographs, you're not going to pick up on anything on the thyroid on an x-ray. Sometimes if it's calcified, you could pick up on it, but for the most part, there's not a lot of imaging that you could do. So it's pretty much physical exam and lab testing. It is treatable. So here, and again, I try to not make this slide too small, but there's some different routes that we can take. First of all, probably the easiest, well, one of the easiest is medication. There's a medication called methimazole, and this can be daily and it can be given via a pill, but because not everybody loves pilling cats, you can get this medication compounded. Are you in pharmacology 2 right now? Pharm 1, 2? Oh, you're in 1. Okay, you may end up talking about this at some point, but there are places called compounding pharmacies. So my cat, I ordered, it's called transdermal cream, and they called it into, there's a low cost compounding pharmacy in Noblesville. There's one, Nora Apothecary in Nora, in Indianapolis. There's Greenleaf. So a compounding pharmacy is they'll take, so you can't get this transdermal cream at like every pharmacy. They'll take the medication and put it into a cream. So what I would do is I would squirt a pump, and that was formulated, and they gave me these little like finger cots. They're like little plastic, and I would put it on that, and then I would rub it in her ear, and I would alternate ears. I'd have to try to remember. I was like, did I do your right ear? And when you rub it in the ear pinna, you do it on the inside, it would get absorbed transdermally or through the skin. So this way I wasn't having to pill her. So it's a nice option. And they found that the medication was equally absorbed transdermally as well as, giving it orally through a pill. So that is an option. The downside, or what you need to do, so I'll make this comment. Whenever we do thyroid medication, the doctor's typically going to guess at a dose. And then usually after you do it for 2 to 3 weeks, they want to bring the animal back in and draw their thyroid blood and retest their levels. Because sometimes it'll take several months to find the proper dose. So you have to have an owner that A, is willing to daily medicate. And I want to say, and my cat, sorry, it was twice a day. It was twice a day, put the stuff in her ear, and then periodic lab work to make sure. Once we kind of hit good thyroid levels, they may extend how long they have to come back until they get lab work. So usually when you're first kind of treating it, we want to make sure the medication's keeping thyroid in a normal level. So it's usually repeat blood work, and then you can do, and this is for life. So again, this isn't going away. So you have to know, they have to be willing to do the medication daily, come in for periodic lab work, be willing to do that. Now, if there is an enlarged thyroid, there is surgery. But like I showed you in that picture yesterday, the parathyroids are attached to the thyroid gland. So number one is you have to try and do it without removing the parathyroid glands, which can be tricky, okay, depending, if you can, because what you're really worried about is you don't want to leave thyroid tissue behind, but you don't want to remove the parathyroid. So it's kind of tricky to do it that way. Usually these patients are at a higher anesthetic risk. If they have a murmur, if they have tachycardia, they're usually geriatric, and the surgery is risky because of, again, I showed you the carotid arteries, the jugular veins, the vagus nerve, the trachea. So it's a very delicate, risky surgery that you can do, and it is curative. If you remove it, they may need to be monitored for their metabolic activity, for being overweight and things like that, but you can remove it if need be. Probably one of the number one treatments that people do, it's called radioactive iodine or I-31 treatment. Now, our So VCA, because we had radiation oncology, we were able to do this treatment. I think IndyVet does this treatment. We do this treatment. And you get radioactive iodide, and we give it to the cat via injection. And what the owner did, let me explain. They would bring the cat in on a Monday. The cats are we had a special cat room, and it is lined with lead, and it has a double door, and the cats are in there, and the doctor and the tech, there was one tech that was allowed, she had to be trained to work with these cats, but she had to go in the room. They would inject the cats with this radioactive iodide, and what the diseased or the thyroid gland, the diseased tissue, would soak up the radioactive iodide, and it would kill the tissue. And basically, then you're kind of like killing the thyroid. But the problem is the cat has radioactive isotopes in its body. So when they urinate, defecate, vomit, salivate, they are shedding radioactive particles. So these cats were in this lead-lined room for a week. So the owner would have to leave the cat for a week. And then the tech who would clean the room, she had to wear special gloves and a gown, and she would have to bag up all of the litter, any trash, and it was picked up by a company. You can't just take it to the trash. So there was a company that would deliver the radioactive isotope, and then they would pick up the radioactive trash, essentially. And whenever she came out of that room, we had to stay away from her. She had a Geiger counter. So she would almost like, I don't know if you've ever seen like in movies, or it's like, tick, 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 and they're looking for the radioactive, and then all of a sudden it's tick, 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 tick. So anytime she'd come out of that room, I'd be like listening, like, is she glowing? Is she, beep, beep, beep? I'd be like, get out of here. But I mean, we would tease her all the time. But the thing is, the owner would pick them up on Friday, but at home for at least, I want to say it was like up to about 2-3 weeks, that animal was still shedding radioactive isotopes. So we told them at home they had to be confined from any other pets, usually put them in like a bathroom or a laundry room. And the owner would have to double glove, and would have to maybe like wear a mask or be careful, and then double bag their trash. Now, they are not shedding as much radioactive isotope as when they were in the hospital, but there's trace amounts. So they went home with a sheet on how to care for them. So for 3 more weeks, your cat's not hanging out on the couch and rubbing on the dog, or you're not really cuddling with your cat. So, and I want to say the cost was about $1,300 to $1,500, but it's curative. So if you think of, let's think about this. An owner could spend money to do medication and blood work, or if they spend $1,300 to $1,500 up front, over the life of treating them medically, you're probably spending that amount. So it's whether you want to spend it up front. But no, Cassidy, they were okay to dispose of it in their trash, but they had to use the thicker trash bags, and we told them to double bag. So as long as they double bag the trash, and they double gloved whenever they handled like the dishes, the cat, they were fine. Then it was usually like trace amounts. And again, so we did this at Purdue. I think IndyVet in Greenwood does it. We do it at VCA. So there's certain clinics. It's actually, the name of the company is called RadioCat. Radioactive cats. But it is, and she sometimes would have 10 or 15 cats. They would do it once a month. So we didn't do this like every day. Once a month, there was 1 week where she would do her cat treatments. And again, if she was in the room, we had a little window that we could see her in the room with the cats, because we couldn't open the doors to like yell into her. Sometimes I'd have to knock on that little window and be like, hey, you okay in there? But now there is a newer treatment, and it's actually a dietary. There is a prescription diet. It's Hill's prescription diet, so it's a prescription, but it's called YD, and it's actually a limited iodine in the diet. Now, the limited iodine will decrease T4. No, Cassidy, as long as once you pass the 3 to 4 week mark, then you were fine. Now, I don't know if the cat died while they were still radioactive, they probably would have to call the company. I'm not sure if because yes, they do still have some radioactive isotope in them, but once we send them home after the week, it's not large amounts. If they were doing a cremation, as long as the people aren't, they'd probably have to contact the cremation company and decide how to do that. So I'm not 100% sure, but this YD, it's a fairly expensive food, but because of the limited iodide, it actually decreases T4 production by them eating this diet. But this is the only thing they can eat. I had considered doing that for my cat, just, because actually there's been really good reports with this diet. But the problem is if the cat eats YD and then you have another cat and it goes eats their food that has normal iodide levels, then it's defeating the purpose. So the problem was I had 2 cats at the time. They both ate free choice and they ate the same food. And I was like, the problem was she'd eaten free choice her whole life. I'm like, how am I going to switch my cat from eating free choice to basically like, here's a cup of food that only you can eat? Now, I could have potentially put the other cat on it, but that would get pretty expensive. So I decided to go the medication route. So the food's expensive, but the owner has to realize that's the only thing that cat can eat for the rest of its life. And again, it's costly, but it has shown to be beneficial without having to give medication. So hold on one second. I just want to make sure he did not get out. So when we diagnose hyperthyroidism, these options can be presented to the owner. Most of the time, I would say most people are probably going to choose medication or this dietary route. And then probably radioactive iodide treatment would probably, is usually offered. Again, the problem is up front, the RadioCat costs the most, but it's curative. And, or with the diet and medication, you're going to probably spend getting up to that amount, but you're obviously going to do it over time. So again, it may be owner call, doctor preference, but there are, ways to treat it. And again, it's a fairly common in older cats. Now let's talk at the flip side is hypothyroidism. Now this is the opposite. This is a deficiency in thyroid production. So again, if we're not making enough hormone, we're talking now about having a low metabolic rate. And so we're going to kind of see the opposite clinical signs as we do with hyperthyroidism. Now, in primary hypothyroidism, stop it. AJ, come here. Stop. In primary hypothyroidism, it can be gradual destruction of the gland. So over time, sometimes the gland gets older and, due to age. And so, you'll hear me talk about atrophy. Atrophy is when an organ just starts to shrink, it's not being developed, and maybe that is affecting the hormone production. There can be what's called secondary hypothyroidism, which is pituitary dependent. Now, remember the connection. TSH is released to maintain the health and growth of the thyroid gland and help cause the release of its hormones. So what if an animal is TSH deficient? So if TSH is not being released, then there's nothing that's maintaining the thyroid gland. also potentially not regulating the release of thyroid hormone, because this is the issue. We don't have enough thyroid hormone. But sometimes I'm like, if I'm the thyroid gland, I'm like, hey, it's not my fault, it's TSH's fault. So, then we're going to have to measure it. And again, it's a middle to older age, in dogs, probably around 4 to 10 years old, which again, a dog's lifespan varies. 6 years old is ancient for a Great Dane. 6 years old is middle-aged for a Cocker Spaniel. So in dogs, lifespan, as you get older, lifespan goes down. So middle-aged can be vague, but it's somewhere, like their middle to their older lifespan for that. And again, this is seen more in dogs. Rarely do we see hypothyroid. I think in my working life, I've seen one, maybe two hypothyroid cats. Some of the breeds that we tend to see it: golden retrievers and Dobermans, Irish setters, Airedales, dachshunds, cockers, I was like boxers, of course, and poodles. So these are some of the predisposed breeds. Now, these designer breeds, these doodles and puggles and things, those dogs are now reaching geriatric age. So whether we're going to start to see it in some of these, that will probably to be determined. But these are the common breeds that we see it. Now, the clinical signs, I saw this slide and I was like, oh, I had to laugh. Big old Basset. But what do I see here? I see a dog that's laying down, tired, overweight, maybe a little unkept. So the big thing is weight gain, the opposite of hyperthyroid. So all of a sudden your dog is getting heavier, but I haven't really changed diet or given extra cookies or, increased their food. So gradually, the owner may have noticed weight gain. Cold intolerant. They just don't want to be outside when it's cold. I put a note, since I say cold intolerant, is this heat-seeking behavior. All of a sudden, if you have a house and your registers are in the floor, like your heat vents, they tend to gravitate to the heat vents and lay there because, again, remember, metabolic rate helps regulate body temperature. So they can feel like they're cold and they want to try and get warm. They tend to look a little dull and have a drier hair coat. One thing is they can get what's called a non-pruritic alopecia. So pruritic is itching. And if it's non-pruritic, if you have a dog that is itching in one spot and they lose their hair, well, that's like, okay, they keep itching, they're going to get rid of the hair. This case where they look like they lose hair, but they don't seem to be bothered by it. They're not like rubbing it or not causing a problem. They can tend to have a rat tail appearance where they start to kind of lose the hair near the tail, or it gets really, really thin. And so obviously if they don't have fur on their tail, it tapers and it kind of looks bare like a rat tail. So they start to get that appearance. The other thing that is interesting is if they have alopecia, it tends to be bilateral, meaning on both sides. It's not, you wouldn't expect to have their bare on their right side, but not their left. Usually in this disease, they have the bare patch on both sides, and they tend to not grow the hair back. So it kind of remains like they've got these bare spots. They can have some seborrhea. So they got that greasy, oily feeling hair coat. Lethargic, sleeping a lot. They're lazy. Now a lot of people with older dogs, they're like, oh, my dog's just old, that's why he's sleeping a lot. But maybe it is hypothyroidism. I'm going to stop there. I know we end at 2:20, it's 2:17, and I'll talk about the diagnosis and medication a little bit more. Oops. Do you have any questions based on initially what I said about hyperthyroidism versus hypo, or what we've started to talk about?